So what was the next step then for you?
Well, the next step was to see various people. There was the people who were going to talk about what may happen to me afterwards. This was Mr. Avery, again a specialist there, and also there was the speech therapists, the dieticians, and the one that really sort of amused me was the anaesthetist. I mean, he told me to get some weight off, and I thought I was quite slim and upright, but get a bit of weight off, he said, and stop smoking.
So they were preparing you for an operation that was coming up?
They were preparing me for a major operation, they said.
And what was that operation, for the viewer's benefit?
Big problem.
What was that operation?
Well, the operation was the most traumatic thing I think I've ever gone through. It meant taking away the left-hand side of my upper jaw, all my cheekbone, all the way around, the nasal bone on one side, and unfortunately my eye socket. Now that resulted in me losing a good 20/20 vision eye, which was a big shock to me.
Yes.
And they had to then replace the inside of my face with a flap, which was taken from my stomach muscles, and that was then sewn into my face and made for upper palate, half an upper palate replaced. And that's what the operation was.
How many hours do you think it was?
That was a 12-hour operation.
Really? So very intense operation.
Very much so. It was, because I asked a question prior to the operation if they could do something about the eye socket, i.e. take a bone from somewhere, from the hip or something, in order to build an eye socket so that I could have at least a false eye. Unfortunately, I would not have survived an operation that long. The 12-hour operation was probably the limit that my body was going to take at that time, and to take a graft of bone at the same time to put up there would be just too much for my body to take, and it would take longer to do it.
I understand. Were you anticipating losing the eye at the time when you went for the operation?
When I went for the operation, yes, they did warn me prior to that. I begged Mr. Avery at the time to try and save that eye, because it meant a lot to me to have two eyes, because I play golf. And, well, I was frightened out of my life, to be perfectly honest.
Sure. I mean, nobody can really tell how they'd react to that change in their body to such a significant degree.
No, I tried to look at what was going to happen afterwards in a blasé sort of manner. Try to make light of it, etc., etc. But unfortunately, it didn't work out that way. It was a devastating thing that happened. You
really felt it was a major setback after that operation?
Absolutely.
And was it the loss of the eye itself, that difference in the vision and the difference in the way you react to the world?
Well, the loss of the eye was a disfigurement. The scarring was a disfigurement. I mean, it's healed up considerably now, it's 2.5 years on. But at the time, it was horrific, you know. I mean, I'd have probably looked good in sort of a Frankenstein monster film or something, because it was that bad. The amount of stitches I had, I lost count after 100, you know, and it was really bad. And the fact that I lost that eye when it was perfectly good eye, that hurt a lot. And yeah, it upset me a great deal.
Okay.